common issue or reason of sub-fertility is non-consummation of marriage. It is WHO certified that male contribute to 50% cases of infertility because, again, of the environment in which we are living. The sperms are so sensitive that they are actually in a pouch outside our body. They can't even tolerate body temperature. How will they be able to tolerate such an... So it's very important for reproductive age group females to get their thyroid tested, and this testing should be at least done once a year.
For a lot of places, maybe stigma might vary depending on the society that we are from. But for majority of women, fertility issue related stigma is still a reality. Why do you think that is?
So if I relate to my family, and I'm a very cultural and spiritual person, I believe being a mother proves your womanhood. This is what people have in their head. And if a couple is struggling for a child, the woman is somebody who is blamed for. But it is very important to understand that women contributes only to 50% of the issue. 50% cases of infertility are due to the male partner. Educating the masses is very important. Infertility is not a woman problem. It's not a feminine problem. It's a couple issue. That's why all we fertility specialists should make it a habit of seeing the couple together, not the woman only. Not only investigate the woman, but at the same time investigate the man as well. Because the problems can occur in either of them. So if we concentrate only on the women, then it will be very difficult. And that's why that guilt of being infertile, and actually infertility is a wrong term. It should be sub-fertility. None of us are infertile. We have a decline in our fertility. So thankfully, especially UK and European nations have recoined this term as sub-fertility and not infertility. Because if we can't label anybody as infertile, that questions our femininity or masculinity. So we are sub-fertile. That's okay. With medical aid, we can still conceive. And it's not at all a woman problem. It's a couple issue.
What are the surprising or lesser known causes of fertility issues in both men and women?
So past 12, 13 years after working in this field, I could understand that the most common issue or reason of sub-fertility is non-consummation of marriage. 50% of couples are not able to live together.
Why?
Either the male partner has erectile dysfunction or ejaculatory disorder, or the female partner has vaginismus. She doesn't allow the man to come inside her. And believe me, this is 50% true.
Whoa.
For people coming to the clinic. And we just need to educate them, talk to them, tell them that this is a mental issue. It's a psychological issue, not a physical disorder or a physical problem. And believe me, out of this 50, almost 25 are able to consummate their marriage just after talking to someone. So they need somebody to tell them that you are normal. I mean, it's shocking.
Yeah.
Absolutely. The kind of scenario we are living in. People can't consummate. And after working in this field, I could realize this is such a simple problem for which people stay back in their house for 2 years. Half of the marriage end up because, having a sexual relationship is an essential hormonal issues which we have. So if one partner is not able to consummate, half the marriages end up in divorce. The remaining half come to a fertility clinic just to understand that by simple talking, not even any medication, this issue can be resolved. So this is the state of affairs, not only in India, even abroad. Wow. Then the second issue which I see very frequently is decline in egg reserve or egg quality in very young age also.
Why?
So there is no concrete answer for this why, but basically it's due to the lifestyle, due to the pollution that we inhale every day, due to the insecticide, pesticide that we eat with our food, due to excessive alcohol, excessive smoking, even at 28, 29 years of age, we have seen a major increase in the people with low ovarian reserves. When we talk about men, now it is WHO certified that male contribute to 50% cases of infertility because again of the environment in which we are living. The sperms are so sensitive that they are actually in a pouch outside our body. They can't even tolerate body temperature. How will they be able to tolerate such an environment? There is a drastic decrease in the male sperm quantity quality. Again, due to the environment in which we are living. These are two, three things which are an eye opener for a fertility specialist. One is non-consummation of marriage, very low reserves at very young age, and low sperm quality.
And so even if you have a billion sperm, it's not able to withstand the environment.
Absolutely.
That's the condition that we are living in. That is very heartbreaking in many ways, you know.
Absolutely.
Please educate us about Hashimoto's disease and fertility.
So Hashimoto's disease is thyroid issue. It is a disorder of our thyroid gland, and thyroid hormone contributes very importantly for fertility of women, from achieving a pregnancy to the rate of miscarriage. Both are related to thyroid because thyroid hormone, number one, governs our menstrual cycle. So if our thyroid hormone fluctuates, then our cycles can go haywire. Secondly, low thyroid levels or very high thyroid levels can lead to anomalies in the child and also miscarriage. So it's very important for reproductive age group females to get their thyroid tested, and this testing should be at least done once a year, if not more than that, so that we ensure that the thyroid levels are within the normal limits for a woman to achieve a healthy pregnancy.
Ma'am, would you say that past ectopic pregnancy will impact present fertility issues?
So what is an ectopic pregnancy? Ectopic pregnancy is implantation of a pregnancy at some other site than the uterus. So normal site of pregnancy is the uterine cavity. But if this pregnancy implants inside the tubes, then it will lead to the damage of tube. And finally, that lady will have only one tube left. Now, ovulation happens randomly from either of the tubes. In a year, if only one tube is left, then she's getting only 6 trials to become pregnant.
And so as the woman's age declines,
it's not related to age. It's related to the health of the tubes. Now, tubes are they act as a place for the egg and sperm to meet. If I have an ectopic pregnancy, my one tube is damaged. So if even though I'm ovulating from that ovary, that egg is not picked up by the tube because it is damaged. So I'm not getting 12 chances in a month. I'm just getting half of it, like 6 or 7 chances. So my fertility is half.
Oh, that's so tragic. What do you think of a sperm preparation machine? Does it help you to practice?
So, absolutely. For IUI, because we are injecting the sample directly inside the woman's womb, we need that sample to be purified, because naturally when a man ejaculates in the female vagina, the vaginal flora keeps the dead sperm, pus cells out of the woman's body. So a sperm preparation machine is very helpful in concentrating the actively motile sperm, and these sperms can be actually filled in a tube and injected inside the uterus. So whenever we are injecting the sample inside the uterus, or we are doing an IVF cycle in which we need prepared sperm, then centrifuge machine is a must.
Would you also recommend a home insemination kit to your patients?
I do. As I told you, there are so many, 50% of the people suffer from non-consummation because either the female partner has a fear or the male partner is not able to perform. So in home insemination kits, if the male partner can give his sample in a container and then the female can inject it inside through a thinner tube. So self-insemination is an excellent method in case people are not able to try it together. And sometimes when the woman is ovulating and the doctor has actually asked to try, then that burden of performance or performance anxiety sometimes leads to erectile dysfunction. So in that case, you take this semen self-insemination kit. If you are able to do the act naturally, very good. If not, at least you have a backup. So that allays the as well.
Thank you for making time for us. And from Subhak Health Tech and from me, we wish you the best in whatever you do and you practice. God bless you.
Thank you so much. It was extremely wonderful to speak to you. Thank you so much.
Have a good day.
You too. Bye-bye.
Bye.